Oh, you can go.
There.
Awesome. Are we going?
Yeah.
Okay, perfect. Hello and welcome to the debate for the ethics of treatment approaches for applied behavior analysis. Although ABA has a long history of developing evidence-based treatments that positively improve the maladaptive behaviors associated with individuals with autism, it continues to be considered unethical by some individuals with disabilities, advocates, and professionals. In this debate, we will examine both sides of the issue using a formal debate model. My name is Lindsay Leto, and I will be the stater for the pro-ABA argument. Before we begin, I'd also like to introduce the remaining group members and their roles. For the pro-ABA treatment approaches argument, we also have Rachel Kemmerer as the prover, and I will fulfill the role of the critiquer. For the anti-ABA argument, we have Josh Poyer as the stater, Tracy Tormes as the prover, and Carly Trainer as the critiquer. Now I'd like to begin the debate by stating point by point why the evidence-based treatments of applied behavior analysis are ethical treatment approaches. First, ABA is individualized, and it utilizes a variety of evidence-based treatments that depend on clients' needs. Goals and treatment methods are tailored to each individual client in a way that still maintains the integrity of treatments, but is uniquely tailored for every client. The interventions of ABA include discrete trial teaching, which is a highly structured teaching technique that uses mass trials to teach new skills. However, ABA is not limited to discrete trial teaching. Other interventions considered behavior analytic include pivotal response training, incidental teaching, verbal behavior, and natural language paradigm. Another point I'd like to highlight is that ABA teaches relevant and functional skills to clients, and the overall goal and efforts of ABA are directed at generalizing skills to all relevant areas to bring meaningful change. In behavior change, programs aim to produce positive behavior changes across all the relevant settings so that clients can perform them with all the relevant people who might present demands and with all relevant materials they might use. ABA also addresses a wide variety of behaviors. It focuses on teaching replacement behaviors for any maladaptive or problematic behaviors that a client has. This allows clients to continue getting their needs met by being able to perform a replacement behavior. BCBAs also hold core ethical principles that guide all of their decision-making, and they're held accountable to strict ethical codes that place a focus on benefiting each individual client, always by supporting an individual's self-sufficiency, treating them with dignity, and treating them with care and compassion. We'll now go over to Josh for the anti-ABA statement.
Thanks, Lindsay. Even though ABA has a long history of being used to help people with autism spectrum disorder, it still has a lot of ethical problems and overall may be an unethical form of treatment. Primarily, punishment, which is a form of ABA procedure, is used, which can have negative consequences. Some people even report developing PTSD as a result of punishment procedures used in their ABA programming. Furthermore, as Lindsay said, ABA uses DTT, but DTT forces children to complete repetitive, non-functional behaviors sitting at a table, and thus makes their behaviors more robotic over time. It also relies on the use of reinforcers, which are often edibles, which can cause children to become hooked on edible reinforcers to produce a desired behavior, further hurting the functionality of that behavior. ABA also fails to address the emotional well-being of its clients through the use of compliance training. It focuses on outcomes for specific behaviors and not necessarily on the well-being of the client that's going through the program. It's also very difficult to get an ABA program running due to immense lack of resources and training of staff. Treatment fidelity measures are usually not recorded frequently enough at ABA clinics, which brings into question the efficacy of the treatment and whether or not the clients are actually receiving any form of treatment at all. This impacts everything that the client is experiencing through ABA. Finally, ABA is a huge time commitment. Up to 40 hours per week is recommended by some BCBAs. Children also have to balance school life, and working families would struggle to find the time to be able to commit 40 hours for their children on top of school and work and other responsibilities that they may have. For all of these reasons, ABA may be an unethical treatment. And now we'll go to Rachel Kemmerer, who will support the pro-ABA argument.
Thanks for that, Josh. Whether ABA is helpful or harmful has become a controversial topic, and I'm here to help those who do not know exactly what ABA is and some of the contentious techniques that are used. So, what exactly is ABA? ABA is one of the best forms of therapy for children and adults with autism. Bear, Wolf, and Risley, the authors of a well-known and established article known as Some Current Dimensions of Applied Behavioral Analysis, defined ABA as the process of knowing systematically applying interventions based on the principles of learning theory to improve socially significant behaviors to a meaningful degree, and then to demonstrate that intervention employed are responsible for the improvement in that behavior. ABA can involve as much as 40 hours per week of one-on-one therapy, developing social skills, learning to write their name, and even go to the bathroom or brush their teeth. The therapy, however, revolves around the individual's specific needs, breaking down each step and rewarding the child or adult for completing each step. ABA overall observes behavior and applies specific interventions to improve socially significant behaviors. So what are some of the controversial interventions that many individuals feel so negatively about? Well, one of them is discrete child training, but today I'm here to inform you that those individuals of what DTT is and why it is helpful to the autism population. DTT is a common intervention used as ABA. It is also known as discrete child teaching. It uses highly structured methods to teach new skills using trials, clear contingencies, reinforcers, and repetition. Here is an example of discrete child training that was used during an ongoing classroom activity, which increased engagement levels across different settings. As you can see, the levels increased during the treatment phase. This shows an example of how discrete child training can be embedded into activities in a naturalistic classroom, which increases the opportunity for generalization. When generalization is planned, generalization can be accomplished. If generalization is the goal when learning new skills, the instructions could vary from the beginning of learning the new skill This may cause the student to learn a little bit slower. Ultimately, when they get to the generalization stage, the skill will be easier to generalize across different settings. Along with varying different types of instruction, it also makes learning a little bit more exciting and not to hear the same instruction over and over and over again. ABA is not just discrete child training. The learning opportunities may be repeated many times. However, they are only repeated until the prompts are completely faded and the learner is performing new learned skills on his or her own. By no means should the trials be large time blocks of match trials. ABA and DTT not only plan for generalization and plans for creative ways to complete schoolwork, they also focus on positive reinforcement instead of punishment techniques to teach adults and children what to do instead of what not to do. Reinforcers consist of token economies, where the child or adult can exchange their tokens for desired activities or items, social reinforcers, such as playing a game, attention, and praise, and edible reinforcers, which are normally faded out and are the easiest to fade out. ABA also follows a code of ethics. They include doing no harm, respecting autonomy, benefiting others, being just, being faithful, according dignity, treating others with care and compassion, pursuit of excellence, and accepting accountability. Now, Tracy Tormes will take over. Thank you.
Thank you, Rachel. I'm going to be looking at the anti-ABA side of things. ABA has a long history of questionable practices. It's based on Lobos's work, and his ideas were that you force change in behaviors, and forcing that change, there comes a lot of negative side effects. They also suggest that you use intense practices, and oftentimes it's 40 hours per week. 40 hours per week tends to be too much for children in an intensive program. In public school, they're not even in school for 40 hours a week. So when you get to that intensive program, it's sensory overload for these kids. Discrete trial teaching is another method that's used in ABA, and it lacks in generalization. There is a philosophy out there that the instruction has to be exactly the same every time, and that creates students to be more robotic than to generalize over the skills they've learned into a new setting. It doesn't allow for them to go beyond the initial direct instruction that they received, and there's not any variant of instruction. The concept that ASD learns best with simplified language also contributes to that philosophy in DTT. Clients, they become robotic. I mentioned that. Several practices that should not be used, according to research, is they use punishment as a part of what they do to change behaviors. And most parents are not comfortable with punishment. When children are having difficulty learning, patience should be used when teaching new concepts, and punishment just should not be a part of the plan. Adults with ASD report having post-traumatic stress disorder due to the intense ABA practices that they went through as a child. And punishment has lasting effects, and it is not beneficial. There is a study that was done, and I'm going to show you a chart on that study. And in this study, it shows, as you can see here, that they have a punishment component to the research that they did. And they report that with the punishment, the practice was very effective. And so the concern is that when punishment is effective like that, then the issue is going to come in that the problem is that it's going to be overused. People are going to continue to use it because it's effective. And I'm sorry, let me get back to my other spot. With when studies prove punishment phases to be effective, it's going to be extremely hard for people to phase those out of what they're doing. And is there really true long-term behavior change when punishment is implemented? Because typically punishment is effective as long as the punisher is present. And once the punisher is removed, then it's no longer effective and they'll return back to their old patterns, which stops the generalization as well. Strategies used in ABA also have potential for abuse. Examples of that would be hand-over-hand manipulation or overcorrection. Aversives are also used to discourage unacceptable behaviors. When anytime aversives are used, there is potential for abuse. Food and breaks are withheld until certain behaviors occur. And that, again, is also an opportunity for abuse to step in. These type of strategies can be detrimental to students and to the well-being of them and can lead into abuse. Another concern in ABA is it's time-consuming, and this can be frustrating for the child and burdensome on the adult. The frustration can manifest in tantrums or other maladaptive behaviors, and then the adult may lose their patience because the child is frustrated and not behaving appropriate. These actions can lead to overcorrection, aversives, and punishment again, and the cycle repeats. And now we're moving on to the ABA critiquer.
Thanks, Tracy. So I just want to go through now and discuss some of those points by the anti-ABA side. A little bit of a rebuttal for some of those points. The first one I want to address is ABA, when it's portrayed as more of an intensive therapy in the DTT structure that turns children into robots. I'd like to bring up that research that Rachel talked about, the article by Bear, Wolf, and Risley that discusses the 7 dimensions that make up behavior analysis. So these 7 dimensions remain critical for what ABA is considered today. And one of those discusses the need for behavior change to have generality. And so to have generality, a behavior change must be durable over time so that clients can continue to perform the behavior as days and weeks and months go by. It needs to appear across a variety of environments so that they can, if they learn the skill at home, then they can also learn to perform it at school, out at the grocery store, or wherever it's relevant to them. And it also needs to spread to a variety of behaviors. So thus, a child could perform all different kinds of similar responses that function to do the same thing without needing to be taught each specific behavior. So any interventions that don't include these generalization components wouldn't be considered behavior analytic. So providing instruction in various ways and under various circumstances and settings helps to achieve this generalization. And so a lot of times programs might begin with the more structured DTT segments if it's a skill a child has never ever learned before and it's totally brand new to them. And so the structure can help them pick it up a little bit more quickly. And then as they acquire the skill, ways to generalize the skill will quickly be programmed into that kiddo's program. So those who implement interventions are actually encouraged to vary their instructions to promote generalization. According to Cooper, Heron, and Heward, generalization of skills can be taught through programming common stimuli, using multiple exemplars, and teaching a sufficient amount of examples. A lot of ABA is then incorporated into natural teaching strategies, using playtime, and the DTT skills as well can be taught in a more natural setting. So it is much easier for them to transfer it into the natural opportunities when it comes up. Another argument I'd like to discuss again is regarding ABA and the use of punishment. ABA uses punishment only as a last resort when other techniques have failed and the behavior puts someone's safety at risk, whether it's the client or maybe a peer or somebody else. And behavior analysts have really strict ethical codes, and their ethics code 4.08 specifies considerations that must be made before implementing any punishment procedures or aversive procedures. And first, it talks about how behavior analysts always recommend reinforcement before punishment as an initial teaching strategy. Punishment is only considered after other strategies have failed. Second, if and when punishment procedures are needed, behavior analysts always include teaching a replacement behavior so that they wouldn't only be punishing the really dangerous behavior, but giving that client another way to communicate and to have a voice. So this way, when the punishment procedures are faded out, the client has the replacement strategies in place, which are functioning the same way that that challenging behavior was. Behavior analysts also ensure that any implementation of aversive procedures is accompanied with an increased level of supervision, training, and oversight to make sure it's being done the correct way, that the behavior that is receiving the punishment is actually that behavior and not some sort of like precursor behavior, to ensure that the safety of that individual. That also includes a more timely evaluation for progress, or a timely evaluation of progress for modifications, so that that punishment can be faded out as quickly as possible. Ethics Code 4.10 discusses avoiding harmful reinforcers. Behavior analysts actually minimize the use of items as potential reinforcers that might be harmful to the health and development of clients, or that would require any excessive motivating operations to be effective. And so that's the rebuttal for the ABA side. And we will go over to Carly now for the anti-ABA critique.
So effective ABA therapy requires highly trained and dedicated staff. Without highly trained staff, there's a large possibility for ineffective treatment since ABA therapy needs to be so precise. Successful ABA therapy produces a meaningful change in the student or client's behaviors or their abilities. And in order for this meaningful change to occur and for skills to be acquired, generalization needs to occur, because without this generalization of this skill, whatever was learned is essentially useless in real life. So you can teach a student to respond to "how are you" by saying good or fine, but if you're just teaching this skill in the discrete trials at the desk, the student probably will not carry this skill over into real life situations, which should be the ultimate goal. So when they're at home and their mom or dad asks them, "how are you?" they probably are not going to respond with good or fine like they were at the desk. So the skill that you taught them is essentially useless. Anything taught to the student should ultimately be generalized across all settings, as well as all teachers, parents, peers, or whoever, in order for it to be successful. It was stated before that generalization can be planned for and accomplished, but if you do not have the highly trained staff, this can be difficult because there so much needs to go into this planning for generalization to occur. ABA aims to teach relevant and functional skills to meaningfully impact the client's life. But the BCBAs are the ones who decide what is appropriate and what is best. The clients do not always have a say. Discrete trial teaching tends to teach clients to automatically respond on cue to certain things or whatever that may have no real meaning to them. So an example is teaching sight words in discrete trials. If the student is just memorizing the words by looking at them and not sounding them out, then they really aren't reading. They're just memorizing these words that have no real meaning to them. So a BCBA might put this program in place in order to meet the ultimate goal of reading, but if they can't sound out the words, then they really won't be able to read in the long run. So the goal and teaching of all these sight words is pointless. BCBAs do not always come up with goals with the student in mind. Sometimes the goals they write are influenced by the parents or the typically developing peers' curriculums or whatever they think is a socially acceptable skill, when in reality is not meaningful to the student. When goals and targets aren't meaningful to the student, then they probably will not be making progress on them. Addressing maladaptive behaviors is another thing that BCBAs deal with, which can lead to potentially dangerous situations. An example is the concept of escape extinction, which is not allowing the child to escape an aversive situation due to problem behavior. This not only goes against the child's wishes, but it also is a potentially dangerous situation where the client is exhibiting self-injurious behaviors to avoid reinforcing escape, and this can quickly become dangerous. BCBAs and ABA therapists oftentimes pick battles that are not worth picking, and addressing behaviors that they think are socially relevant or important, but in reality are insignificant to the client. So implementing escape extinction on these insignificant things can do more harm than good most times. And this goes back to the point about BCBAs choosing what is important or meaningful for the student. And although BCBAs have the code of ethics, it is not always followed. An example is a common ethical dilemma of how many hours of ABA the child is getting versus how many they actually need. And according to Lova's study, children should be receiving 40 hours of ABA a week. And school districts cannot always provide this, and insurance companies do not always cover this amount of hours, yet children are still receiving a fraction of this recommended time per week. So most often clients are receiving the amount of therapy they can afford versus the amount that they actually need. And this may not be in the best interest of the client because it is not bringing about a meaningful change, which is the ultimate goal of the therapy.
So now I think we're supposed to do questions. But Rachel's gone.
Looks like our questions next. We have, I think I can take this first one, our punishment question.
Do we want to pause while Rachel's gone, maybe?
Yeah.
I don't know if it's still recording without her.
Oh, there she is.
Cool. All right. Got it.
Perfect. Are we still going?
I believe so.
Okay.
Yeah.
I see we have the 3 questions at the bottom. Josh, would you like to start with that one that you have, or I can do the punishment one?
Yeah, I'll start with
Okay.
one of our questions. So one of our questions was, how can you help a parent understand the use of reinforcers to shape behavior? They may have concerns that their child will become dependent on reinforcers. And I think that a problem with a lot of parents dealing with ABA is their understanding of the word positive, punishment, negative reinforcer, things like that colloquially, and not as we understand them in behavior analysis. So many people associate the word reinforcers in ABA with things like edibles or tangibles like candy or toys. However, a reinforcer is anything that increases the likelihood of a behavior happening in the future. And so the idea of people getting hooked on reinforcers is a little silly because everyone is hooked on reinforcers. Common reinforcers that people see in their day-to-day lives might be positive praise, eye contact, laughter, anything that's going to make us do something again or lets us know that we did a good job doing something is a reinforcer. And ABA ultimately seeks to take things like candy or toys and link them to those more common forms of social reinforcers so that eventually the behavior that's being taught is being reinforced in a client's day-to-day life. So hopefully that would help parents understand what reinforcers are all about in ABA. I think always trying to connect behavior to all people and kind of dispel the idea that it's specifically autism related helps people understand some of these concepts better. Now we can either go to generalization with Carly or back up to Lindsay for punishment.
I can do the punishment one. So another question we have is, how can you help a parent understand the use of punishment procedures as a part of their child's treatment plan? And kind of what concerns might come up with that. And so a lot of parents' initial concerns when they hear about punishment procedure, they might think of kind of punishment in the colloquial sense instead of punishment, how it functions behaviorally. So they may automatically think of things like spanking or loss of privileges or other really aversive procedures that would be detrimental to their child. And so helping parents understand what punishment is more in the behavioral sense at the beginning. Really, it's anything that causes a decrease in behavior. So giving them maybe everyday simple examples of how punishment might have effects on their behavior, because we experience it every day. Could be a good way to start, just to help parents think about the idea of punishment a little bit differently. Also providing examples of things like extinction procedures that might help parents have a little bit better understanding as well. That's all for that question.
Okay, I will read the next question. It asks, it is important to remember that punishment can be negatively reinforcing to the person implementing the punishment. For example, when a parent yells at a child to be quiet and the child quiets down, then the adverse stimuli of the loud child is removed from the parent. If this increases the likelihood of the parent yelling at the child in the future, then yelling is negatively reinforced to the parent while punishing to the child. Given this dynamic, what strategies can be put into place to ensure that punishment is not overused or misused? One of the things that when I'm working with students and parents that I talk to them about is that we have to focus on the positive things and the replacement behaviors. And if there is necessity for a punishment procedure, that it be a small, minute part of the plan. And to give you an example, I've been working with a student who is very physically aggressive and has a lot of understanding about his actions and things. So we have taught him, we've put lots of supports into place and taught him about what he can do when he's angry at school, what are his options, how he can manage his anger. And we have been reinforcing him for any time that he uses those things. But when explaining to mom about the punishment component, we wanted to make sure that she understood that it wasn't the biggest part of his plan. The bulk of his plan was on the positive side and reinforcing the correct behaviors, because mom was already in a negative frame of mind about her son and really overwhelmed. And so we downplayed the punishment side of that. But we also went to the level of trying to educate her, to teach her why it was necessary and why we can't overuse it, because if we overuse it, it's going to lose its effect. So the punishment side of his plan was, is if he becomes aggressive, he has to leave for the rest of the day. And over the last year and a half, he's actually only had to leave school 4 days now. And so it's been very effective. And he was aggressing repeatedly throughout one day. So his aggression dropped drastically. But the focus for mom, when we were explaining it to mom and teaching mom about it, is that it has to be very, very seldom that happens, or it will lose its effectiveness. And so I think that gave her a jump start of understanding punishment to a better degree. And it also made her aware of overuse and the way it loses its effectiveness. And we kept the punishment at the school level and didn't ask mom to be involved in the punishment at all, other than picking up her child. So I think that education is a big part of making sure that it's not overused. And also, when you're looking at a plan, making sure that you are not already reinforcing a maladaptive behavior the parent has. You don't want to continue something that they're doing. So breaking that chain in the behavior is also appropriate. Anybody else have any thoughts on that?
No, I think that covers it well.
I agree.
I can go next. These were questions that we developed on our own that related to the topic. Kind of like questions to pose for all the groups. The first question is, how can we address parent concerns about not having the time or resources to commit to an ABA program? One of the myths that we have talked about pretty often in this debate was the huge time commitment, somewhere in the area of 40 hours a week to be effective. And it's definitely not a requirement of ABA. Although committing more time is definitely beneficial, in the extent that it gives the child more time to practice the skill that they're learning, and a great deal of progress can be made, though, with a smaller time commitment. Often overlooked and far more important than the amount of session time is the amount of time the child sees the caregivers and how much the caregiver buys into the behavioral system. Even if it's at 40 hours a week, a child sees their family far more than they see the BA. It is the responsibility of the parent to help create the best results, to follow a behavioral program as it's laid out by the BA, in order to guarantee the child is meeting the same expectations in all the parts of their life. This will also help with generalization. Anybody else have any comments on that question?
Yeah, I think highlighting parents' buy-in into the program is really crucial in having the behavior changes be maintained, because kids spend the most time with their families. So I think that was a great point.
I was going to add that one of the things that I did with a couple of families that I worked with, they had older siblings that were really good at working with the child. And so not only did we train the parent, but we trained the siblings, and they were actually better implementers than many professionals that I have worked with, because they had the passion to help their sibling grow. And they also were very black and white and non-emotional, where the parents can sometimes get emotional about how the child is responding. And so sometimes just doing the peer model approach, where you're training the peers to do the actual implementing, has been effective.
All right, I think Carly has the last question.
Yeah. So I can do the last question. So how is generalization planned for? So there's a lot of ways that generalization can be planned for in ABA programs to help the child transfer their skills learned to day-to-day life. So the key to generalizing the skills is by varying the ways in which they're taught. So teaching the skills in discrimination with other skills being taught or already mastered skills, varying the people who run the programs and teach the skills with the child so they learn to respond to the skill or do the skill with all different instructors, and also varying the location in which the skills are taught. So this is important so that they're not just performing the skill in the school, like they should be able to perform it at home or in the community. So yeah, just varying the ways in which the skill is taught will really help them to generalize the skills across all settings and across all people. And then programming a variety of reinforcers for a particular skill and slowly transferring the reinforcement entirely to socially relevant reinforcers will also create more situations in which the child is prepared to utilize their skills in the community. So transferring their reinforcement from, like the iPad or something like that to social praise and stuff like that will help them when they go to use these skills in the community or for their jobs or something like that. If anyone else has any comments on this question.
I think that covered it.
I agree.
All right. So that's the debate.
That concludes our debate. Thank you for watching.